Okay, everybody, it's time to talk about some iron. I know you guys have been looking for this video, but here it is. And iron, we'll discuss more tomorrow when we talk about in lecture time. So have some fun and exciting things to do. I'm going to go back one slide. Why it slipped, I have no idea. So when we talk about iron, things we're going to cover when we talk about iron is when you first look at these two tablets, what do you see? I see two green tablets. What do they look like? Maybe some M&Ms, maybe some Skittles, maybe some candy. We'll talk about that in just a minute. And the importance of that reason of what does this look like? Talk about iron and iron supplements. How are you going to give it? What route? Why do we take iron? You're going to get that question when you administer iron to your clients, patients in the hospital. They're going to ask you, why am I taking iron? So you need to be ready to answer that question. Why does my body need iron? And we're going to talk about doses for men and women. Not so much children, but we'll talk about adults. Where's iron stored? How's it made? What's the process of it being made called? And where are we going to get iron from other than medication-wise? Flipping my pages over. Iron is a mineral. Now, in the section, I'm sure that most of you know, and maybe if you don't, let me stop sharing, and this is what I want to show you. Let me do this again. Let's talk about some iron. Let's share this one first. And then this is what I want to talk to you about. These are the things that I just went over. So if you don't know this already, if you'll grab a hold of this little tiny line and pull it up or down, this is your notes box. Perfect place to put your notes when you're making notes about iron. All right, so stop sharing this one. Let's go back to where we were. When we talk about iron, there's iron. Why do we need it? Okay, iron is a mineral. There it goes. Okay, sorry, technical difficulties. Iron is a mineral, and get rid of me so I'm not having to look at myself. I think I have it on automatic roll, so maybe we need to hurry up. Iron is a mineral. Iron is an essential mineral for healthy blood production. Hematopoiesis is that word. Hematopoiesis. Vital for hemoglobin regeneration and building hemoglobin cells. Treating iron deficiency anemia. Iron is absorbed in the small intestines. And way back then in the chemistry, when you talked about iron, you knew it as the symbol, capital F and little e. Although iron has many roles, its most important role is the production and help production of hemoglobin. What is hemoglobin? Hemoglobin is that cell in our body that tells us if we have enough blood or we don't. Hemoglobin is an iron-rich protein and red blood cells that makes us nice and pink. Our color is nice and pink when our hemoglobin levels are good. When our hemoglobin levels are not good, what color do you think that we might be? That would be pale and pasty. Iron replacement is given primarily to correct or control iron deficiency anemia, which is diagnosed on a lab smear. Iron supplements take time to improve the level in the body. It's not an immediate response. Some iron takes up to 7 days, 3 to 7 days. Not necessary to remember that, but just know that iron takes a little time to get in the system. Where is it absorbed? In the small intestines. Females need at least, according to research, 18 milligrams of iron a day. Men need 8 milligrams of iron a day. A nice to know, not a need to know. So iron supplements can be given this way: iron dextran, ferric gluconate, and ferrolicet. These are IV agents. When you give ferrolicet in the facilities, you'll give it with your instructor, faculty member, and there's really some important things about giving iron IV, if your instructor lets you give it, that you need to know. The biggest thing is you need to check your clients for any hypersensitivity to iron, or if they have ever had iron before, we need to know if they had any reactions. Iron solutions are rusty, IV agents in color, and again, hypersensitivity, especially with the IV form. This route is used for people who cannot take iron orally, non-compliant with their med regime. Dialysis patients will get this, and bowel disease. Why bowel disease? Because they can't absorb it. And where is iron absorbed? In that small intestines. So let's talk about IM methods of iron. Giving it, what method do we give it? We give it Z-Track. You learned that with Ms. Doig when you were in your lab for practice on IMs. Why do we give it Z-Track? Because it stains the skin and it's an irritant, so it doesn't leak out. Z-Track is to prevent skin irritation, leakage of solution, and seals the medication inside the skin. Oral supplements of iron, you'll see iron tablets, just like those 2 green tablets we looked at a sec ago. And you'll see them in doses of 300 milligrams to 324 milligrams. And you'll see this letters outside called EC. That's enteric coated. Why do we need it enteric coated? So that it doesn't start absorbing until it gets to the small intestines. And it's safe to give with an enteric coating, so it doesn't start to break down until it reaches the small intestines. Iron supplements, vitamins and drops, you'll see them. Vitamins for kids and drops for kids. There is an oral solution of iron, and when you take iron orally, it is rusty in color and it will stain your teeth. So you have to remember to administer it with a straw. Must drink that one through a straw. Iron supplements are given to kids, children, ages 6 months to 2 years. Why? Because these kids grow so fast. If you have children, you remember those growth spurts that they went through? They're rapidly growing and their body's rapidly developing. So some little ones may need this iron as a replacement. Pregnant women may need iron supplements to reduce and replace the iron used by the developing fetus. Prenatal vitamins. Some women can't take the adult brand of prenatal vitamins, so you will hear them say, I take the children's supplements. Flintstones is a children's supplement. It's just a brand, but you'll hear them say, I take the Flintstone brand. So at the bottom of this slide, remember, iron solutions you give liquid must swallow with a straw to prevent staining of the teeth. Remember that in EC is enteric coating. That ensures that iron doesn't start to break down until it reaches the small intestines, so it can be absorbed there. The onset action of iron takes a couple of days, and its peak action doesn't occur for days as well, because it just takes time for iron to be absorbed and process what it needs to do in the body. Iron tablets, boy, look at these green tablets and these M&Ms and these Skittles. Do they kind of similar look like the iron in the beginning when we looked at those 2 green tablets? Are these iron? Kids may think that the iron tablets in the container are M&Ms or Skittles. So they're not. So that's why children need to be protected from the iron medication. So it needs to be stored in a higher up place that kids can't get to it. Yes, kids love to climb And those adolescent kids love to climb on cabinets. So make sure that you keep that in a safe place. You want to teach, we love to teach. We want to teach our elderly clients about iron, and we'll go through the education that they need. Iron toxicity in children can happen very quickly, and it ends up to be a poison control issue if they take 10 tablets of ferrous sulfate, which is iron, at one time. If they take it and they're not given medical treatment within 12 to 48 hours, it can be fatal for children. It can lead to shock, it can lead to hemorrhaging. So just make sure that you're keeping these iron tablets away from kids. Some iron products are distributed in bubble packets, and who doesn't love to squeeze a bubble pack and get something out? So there's danger for kids in overdosing, toxicity, 10 tablets or more. So they remember those things, especially with multivitamins. Kids love, if it tastes good, they're going to eat it. So my mom and my grandmother used to say to me, when I was taking medicine that was liquid, they'd say, oh, if it tastes nasty, it's good for you. So maybe that's why they make nasty oral medicine. Okay, moving on. All right, I know some of you are old enough to remember who this guy is in this picture. So who is this? That is Popeye. Popeye used to eat his spinach to get stronger when he needed spinach to beat up Brutus. So most of us get all the iron we need through our diet. What foods are a rich source of iron? And we also, when we're having to supplement our body with iron, folic acid and B12 help produce those healthy iron levels. Sliding on. So here's a picture of iron-rich foods. We have chicken, pork, liver, beef. As a kid, I remember my mom used to feed us cow liver, and that was not one of my favorite meals. So egg yolks, shrimp, and clams. So one of the things that you need to remember for iron-rich food, sorry if there's any vegans or vegetarians in the class, but we'll talk about some sources of vegetarian and vegan meals here in just a sec. But your red meats, dark meats are very iron-rich food. Why is that? Because the darker meats have more blood in them. I know that sounds nasty, but they are rich in iron. So those dark meats, red meats. Egg yolks, the yolks are a good source of iron. Clams and shrimp, we just said. So let's look at our vegetables for our vegetarians. Broccoli, dried beans, green peas, spinach, raisins. Who would have thought watermelon has iron in it? You'll have to eat a lot of watermelon to get enough iron. So dried apricots and other dried fruits. But those are some good pictures of what iron food sources are for iron. All right. I like to play the question of the day. You guys know this. So let's talk about questions. Which food sources are highest in iron? I just told you that. Think about it. So foods that are iron rich, animal proteins, beef and liver, there's dark red meats, dark meat turkey, spinach. You have to eat quite a bit of spinach to replace your iron. So there are fishes we didn't mention earlier, but halibut, haddock, salmon, and tuna. Shrimp. A cup of cooked beans has a good iron source, and it also has a good source of fiber that you need to add when you're taking iron for constipation. We'll talk about that shortly. Kidney beans, lima beans, and chickpeas. There are a few sources, shrimp and chickpeas, that are lighter in color, but if you think about your fishes, your halibut, haddock, and salmon, and tuna steaks are dark red, and I love some tuna steaks, and I love me some salmon. And if you cook them fresh on the grill, they're very delicious. So let's talk about client education. I cannot say enough, nursing will teach patients, clients, and I've told you guys before, I said this in the Sims when we were talking about subcut and IM. The best time to teach your client is, if you remember, but let's go back. Client education, take iron daily. Some folks are taking up to 3 doses in a daytime. That's a lot of iron. But most of the time you'll see them only take 1. It's best taken an hour before meals. If you are non-tolerant to that iron and it makes your client nauseous or upsets their stomach, you can take the iron with a meal. So food helps decrease the upset stomach. Iron can cause constipation, so we need to teach our clients about constipation. Increasing the fiber intake, we said that just a second ago. Fluid intake, if they're able to increase their fluids. Taking iron supplements just as the healthcare provider ordered, HCP as healthcare provider ordered. If you miss a dose, go ahead and skip it. Then take the next dose when it's due. Never ever double up on iron because it can make you nauseous and upset the stomach. Never take more than prescribed. Some folks believe, and you'll hear this said, well, if I take a little more, then it'll get my iron levels up a whole lot quicker. Not so in this medication. But you always want to teach your clients, take any supplement, any medication, just as the healthcare provider has ordered. If you are on any medication, always check with the pharmacist to ensure it's safe to take your medication, iron especially, with any other medications. Now, you need to teach your client as well, when you're taking iron, it can change the color of your stool to a dark gray color and keep out of reach and sight of children. We talked about that earlier. Adverse reactions most commonly seen when taking iron is that gastric, stomach upset, and constipation. Question number 2. When is the best time to educate your clients? I just said that a second ago. I told you guys, some of you in Sims one day. So as you are checking your medications and you've pulled them out of the machine, the med machine, the Omnicell, Pyxis, or whatever your device that you're getting your medications from, and you are standing at the bedside, you've checked them, you've done your 5 rights, you've asked your client their name and date of birth, and do they have any allergies? So the best time to educate is when you're fixing to give them. So as I open my packet, I'm opening it and I'm saying to my client, okay, so I have iron. This is iron. Do you know why you take iron? Have you taken iron before? And I go on with all the other medicines in that way. So I know that they know why they're taking the medications that they're taking. And if they don't, it's time to educate. So here are some dietary education things that you can teach your patient about iron. Don't take iron with antacids or calcium supplements. Take 1 or 2 hours apart from a meal. Omeprazole is one of the medicines that is an antacid. It's not really an antacid. It's considered an H2 blocker, and you'll see it given. I believe Zantac is you can't get Zantac right now. They've been taken off. There's been some research about that. You've seen commercials on TV about that. So what is cimetidine? Tagamet. And you'll see some other antacids listed, H2 blockers, but you do not take it with antacids or calcium supplements. You take it 1 or 2 hours apart. So if you take your antacid, you're going to have to take your iron 1 or 2 hours later. So don't take your iron. Do not take iron with antacids, calcium supplements. Boy, that's a repeat. Sorry, guys. No milk, no yogurt, no cheese. So some folks say, well, if I drink milk with my medications, I'm good. Not with iron. So don't give it with milk, with water. Iron can be taken with vitamin C in small amounts, but remember this, you don't want to drink the whole jug of orange juice when you take your iron. Just your regular 8-ounce glass with your iron tablet. And why is that? We don't take things with antacids or calcium supplements because it blocks the absorption. It doesn't help absorb because your body's got to absorb everything else you just took. So iron with vitamin C, ascorbic acid, you'll see it called when you're pulling meds, it helps the body absorb the iron a whole lot easier. What other sources of vitamin C can you think of that your client can take or eat with? Famous question. You're going to get this. Your client may say to you, why do I have to take iron? Why am I taking this? Now's a good time to tell them why. Sometimes folks don't remember, but here's why. Reasons to take iron. Iron deficiency anemia. That's just a lack of iron in the bloodstream. We said earlier that iron binds with hemoglobin to make the hemoglobin cells stronger, and the heme of the hemoglobin is what oxygen attaches to, and as the blood travels throughout the body, your body needs oxygen. A reason for taking iron is important for making those red blood cells. What are red blood cells called? Erythrocytes. And it helps those RBCs, red blood cells, erythrocytes, carry oxygen around in the body. Iron and hemoglobin. Hemoglobin is an iron-rich protein in your red blood cells. 60% of our body's iron is found on the red blood cells. That is in your book. Hemoglobin is responsible for carrying oxygen molecules to our organs. It makes us nice, pretty, and pink when we have enough. Anemia is another reason that we would have to take iron supplements. Iron deficiency anemia. What do these folks look like when you see them? When you do your assessment and you walk in the room and the patient's got the sheet pulled up to their shoulders and their face and their hands and their arms look about the same color as their sheets, something's wrong. They should be that color at all. People should be nice pink. But when you see someone with pale, cool, and pasty skin, they're short of breath, their muscles are weak, their GI system, their stool changes color, their spleen gets enlarged, they become hypertensive, they have a fast heart rate. Some folks will end up with chest pain and even have heart attacks. And then neurologically, these folks are tired. They get dizzy. They faint. What's the medical term for faint? Syncope. So fatigue, pale, cool, and pasty, you'll see these folks quite a bit with these symptoms. Why are they short of breath? Because they don't have enough oxygen. They don't have enough iron to help that hemoglobin carry the oxygen. Why does our stool change color? Especially if it's dark and tarry. Because there's somewhere in the body, there's a bleed in the intestinal tract and we're losing blood. Hypotension comes along a little bit later in the system when iron is low because we don't have enough blood supply and there may be a bleed somewhere in the intestinal tract and we end up losing our blood pressure and making it becomes low. When that happens, the heart rate goes up. So it's a compensation between the two. Let's move on. I hoped this picture looked better than the last picture I had on here. And what does your client look like when they have anemia, especially iron deficiency anemia? Let's start as a clock looking at the picture, and the head is 12 o'clock, and let's move to 1 o'clock. Centrally, neuro-wise, they're fatigued, dizzy, and they faint. They have syncopal episodes because they don't have enough blood to carry around in the body to make good hemoglobin cells. Their blood pressures get low. Heart rate, some folks will complain of palpitations, skip beat in the heart, fast heart rates, chest pain, because we don't have enough good oxygen getting to my heart. Angina is another word for chest pain. We'll learn a little bit more about that when we talk about anti-anginal medicines. And if I don't have enough good oxygenated blood to my heart, then what happens? I can have a heart attack. When I am anemic, my spleen can become enlarged. What happens in the spleen? There are red blood cells stored in the spleen, and also in the spleen regenerates old blood cells. So it doesn't have enough, so it's working overtime to help create and spit out those old ones that it regenerated before to get them out into the system to help. Intestinal changes that we will see in folks that are iron anemia is the color of their stool change. Narc and Tari, if they're bleeding, if they're taking iron, we need to teach them that sometimes their stool will turn gray. It's important, most important, if your stools and you're taking iron, if your stool changes to dark, tarry, even bloody, you need to let your healthcare provider know ASAP, ASAP, right then, right now. Don't wait. Weakness, respiratory, short of breath. We said earlier why. Skin, pale, cold, and yellow. Well, the liver becomes involved later on, and when the liver has trouble, it has a tendency to turn your skin yellow. Another word for yellow skin related to liver is jaundice. So when you see jaundice, yellow skin, yellow eyes, and when I say yellow eyes, I mean the sclera, the white part, will turn yellow as well because the liver is struggling. I hope that picture makes sense. Assessment with an anemic patient. You need to take a thorough assessment. History of GI bleeds. Color your stool. Most people don't like to tell what color their stool is, but it's okay. Normal stool should be brown or a yellowish brown because bile secreted into the stool, and that's what color it's supposed to be. And then if you have a history of GI bleeds, then the patient should know if their stool has ever been dark and tarry. That's not normal. Or if it's bloody, that's not normal either. So what is normal is brown or yellowish brown stool. And although, again, it will depend on what you eat, but just remember what I said normal was. You need to ask your clients about their diet history. What have they been eating? I just said. If you're drinking a lot of Kool-Aid with a color to it, well, guess what? Your stool is going to turn that color. Iron deficiency cravings. You'll see folks who have that are iron deficient. They have cravings. They love to eat ice. Ice, ice, ice. They cannot get enough ice. They love the crushed ice, and they nibble and they chew on ice. They also like to eat clay, paper, dirt, soil, or here's the clay word is pica. And again, we talked earlier, have you been tired? Are you fatigued? Are your muscles weak? Can you get up and go like you normally do? Do you need help with your ADLs? Just some questions to inquire when you see a pale, pasty person. All right, let's go to clinical. I'm trying to incorporate this way of thinking this year with you guys when you're learning clinical. So when you are learning clinical and you're in clinical, your instructor will have you look at the patient's or the client's lab results. So which ones should we look at if we know that our patient is anemic? So in this slide, it says CBC. What's on the CBC that we need to look at? The hemoglobin. If the hemoglobin is low and then the RBC level in that CBC, the red blood count's low, that will tell us that our patient is, we need to investigate about our patient being anemic. We also can look at the iron levels. There are different types of iron levels, but in clinical, your instructor will help you with that. And then what did you find with your patient? Are they nice, pink and rosy, or are they pale, pasty, and clammy? When you assess your patient or your client, I have trouble with inverting those words. Are they dysmic? That means short of breath. Have they been short of breath? Do they get short of breath when they get up and walk around? Check their blood pressure, their pulse, and their respiratory rate. Is their heart rate high? Do they get headaches? Are they dizzy? And are they anxious? So one lab that you need to remember that we need to track and trend is that hemoglobin. If the hemoglobin is low, remember it carries those RBCs, and the heme on those RBCs and the hemoglobin is what carries those iron binding oxygen around to make us nice and pink. Dyspnea, what does that word mean? Short of breath. So when we look at in the clinical area, according to your book, it says that the normal hemoglobin levels on a male clients should be between 13 and 18 grams per deciliter. That's a G/DL, capital L. And women, females, 12 to 16 grams per deciliter. So why is females lower than men? Because women have a cycle, and when their cycles are heavy, they have a tendency to drop that hemoglobin level. The lowest hemoglobin in my career that I have ever seen in a patient that survived was a young gentleman who walked into the emergency room pale as a ghost. He ended up in ICU with us, and his hemoglobin was 2.3. Men should be between 13 and 18. He survived, and he went home after that, but he had sat at home for a month with a GI bleed. He didn't want to come to the hospital. He didn't want anybody to know he had blood in his stool, but he got to feeling really bad, so he ended up in the emergency room. Quite an interesting case. How do you know if the iron's working? To evaluate its effectiveness, we need to make sure that the hemoglobin levels are coming up. Are the RBC levels, red blood cell levels, coming up? Iron levels should increase. We want to check those. And then the client will tell you that they're getting their energy back and they begin to feel better. But how long does this take? It takes up to 3 to 7 weeks. A nice to know, not a need to know, but it does take some time. Remember that. Medications that you're going to see called erythropoiesis stimulating agents, red blood cell stimulating agents. This medication is given to folks, to patients, to help them produce red blood cells. Who's going to get it? Your dialysis clients, clients with kidney disease, and your chemotherapy patients. When they're getting chemotherapy, we're killing off, getting rid of bad cells and good cells. You're going to see these medications, and they're called Epogen and Procrit. And then you're going to give them either IV or subcut. If they're in dialysis, the dialysis nurse more than likely is going to give it when they're on dialysis towards the end of treatment. You guys will see that eventually. So when you give these medications, you will always want to check name and date of birth and allergies. Do they have hypertension? That's what HTN is. And have they ever had a cardiac event when they've taken these medicines? The target hemoglobin level when you give these erythropoietic stimulating agents should be up to 11%. Question of the day, second or third, we say. Clients are often given iron pills by their healthcare provider. Instructions in giving these iron pills should include, I forgot to put select all that apply. So the answer, there's multiple. All right. So in this situation, are we going to take iron with milk to avoid our GI upset? No, we're not. So are we going to, will iron have a potential to cause constipation? The pause is for you to answer the question. Yes. Keeping these potentially toxic pills away from children. Sure enough, D, take these pills with antacids to prevent GI upset. No, we said earlier that we need to take them 1 to 2 hours apart. If the medication, iron, is causing that much of a terrible GI upset, they need to let their healthcare provider know. E says, have your blood periodically tested to check your hemoglobin for effectiveness of this medication. Yes. F, your stools may be colored dark green or gray. Yes. So the correct answers for this slide are B, C, E, and F. And I will add to it, believe me, select all that apply. Symptoms of anemia. Can you tell me what they are? Pale, pasty skin. She's holding her hand on her chest, so that means that she may be short of breath. We're looking at her. I wish this picture was in color. We need to ask her some questions. Have you been weak? She says, yes, fatigued and tired, and my muscles are so weak. I'm so short of breath. I've been dizzy. And my stools, I don't know why they're this color, but they are dark and tarry. And tarry just means a color of black. So remember the things we talked about in assessing your client, making sure that you do that history with these folks. Next slide I love. Here in this picture, can we drink orange juice and take iron? In small amounts, yes we can. What does orange juice and iron do? Orange juice helps our iron absorb better. Where does iron absorb? In the small intestines. Now, let's look at the next picture. What's in that picture? Antacids in milk and a big no symbol on the red shirt. Don't take them together. Then I have increase my water, increase my fiber, and I need to get up and walk because that's going to help me go to the bathroom better. Now, I'm taking it that this picture over on the bottom left, the purple, that looks like candy. So I need to put this iron up away from children. What is the chemical symbol of iron? I am not going to hold you to that, just for your knowledge, capital Fe. And then look at this picture in the blue t-shirt. We're going to increase our water intake. Same thing as in the picture of the tan. That's what that picture looks like to me. How can iron be given? We can take it orally. We can take it IV if we're intolerant to taking our medicines the way we need to, or it can be given IM. And what method for IM? Z-Track. Why do we give iron? Iron deficiency anemia. Malnutrition, blood loss, and anemia in pregnancy causes these iron deficiency anemias. Women that have heavy menstrual flows sometimes can lose a lot of blood and their hemoglobin levels will drop and they can become anemic from it. That's a whole nother story. All right, this picture is a review, so look at it and see if you can figure out what the pictures mean, and that will help you learn iron. Another question. Question number 3 of the day. Which administration method for parental iron helps avoid leakage into the sub-Q tissue? Z-Track, number A. So we're going to give this medication Z-Track when we give it iron IM, right? Correct, Ms. McCard. Okay, that is the end of your iron slides, and I will post this recording in just a little bit, and then I will make an announcement on your forum, and then I will see you on Friday when we talk about iron, and be prepared to answer some of Ms. McCart's questions, because I'm going to ask you about it. Okay, have a great evening. and I will see you Friday.